Hello, everyone, and welcome to the 7th installment of our expert series on the COVID-19 pandemic. My name is Christina Wolney, and I'm a part of the partner experience team here at Q-Centrix. And today I have here with me Lisa Everett, who's our senior manager of our Regulatory Measure Division. Prior to joining Q-Centrix in May of last year, Lisa was a registered nurse at Inova Health, where she oversaw the participation of cardiovascular and clinical outcome registries, pioneering the model of successful quality improvement leadership and physician engagement from home. Here at Q-Centrix, she now oversees the clinical operations for key partnerships across the country. So without further ado, I'd like to introduce you to Lisa Everett and have her tell us a little bit about herself.
Hi, everyone. Good afternoon. I'm Lisa. Like Christina said, it's nice to meet you all. Full disclosure, there is roof work going on at the condo next to me. So every once in a while, you're going to hear a bang. Everything's fine. It's just life as normal right now. So Christina, thanks for that intro. The only thing I guess I have to add is that I think I bring a unique background to my work in quality. I held a wide variety of nursing leadership positions before I came to Q-Centrix, and that included running an inpatient post-cardiac surgery unit, running an ER, overseeing nursing supervisors for a major level 1 trauma center, and that combined with my political experience sort of brought me this unique path to quality, and that is what I'm here at Q-Centrix today to do and talk about. So that's it for me.
Well, thank you, Lisa. We're happy to have you and your expertise here today, and I can't wait to hear all of the insights that you have on managing registry participation from home through and beyond this pandemic we have on our hands. So why don't we dive in? Lisa, you mentioned earlier that you had managed a registry remotely for Inova long before stay-at-home orders were put into place. So in your experience then, in addition to the observations you can make from this pandemic, what are some of the key takeaways you have on how to best manage a registry remotely?
Well, I think one of the things, Christina, that worked really well for me is setting up a really good system of communication with my team that was consistent. I say it all the time, you can have a strong presence in a healthcare setting without being present, especially in quality. And I had a very set style of communication during meetings, and also making sure that all of my key stakeholders knew what was going on with the data that we were collecting for the registries. So I think one of the things that I did that worked really well for me is I have a tagline, and it's know your numbers and know what story you want to tell with those numbers. And so by making sure that you've got your key stakeholders invested with you, they are going to be that much more committed to helping support you in the quality work that you're trying to do to improve your patient outcomes.
Absolutely, those are hugely important right now. So on a similar note, can you tell us about some of the tactics that you as a leader take to engage physicians and other hospital leaders with this data and why it's so important to do so?
I can. So one of the things that worked really well for me was making sure that I met with the physicians and the teams that were the most impacted by the data we were collecting to explain its relevancy and why it was really important. And in the beginning, I'm not going to lie, it was not always easy to do, but through persistence and consistency, I got on everybody's calendar, was able to explain to them the reason that we were collecting what we're collecting, and also introduce the registry to some physicians that really didn't know what all was being collected and why. The other thing that I did was whenever there was a new member of the team from the physician side that came on board, and I worked in a cardiology space, I would make sure to schedule a meeting with them. I would work with their assistant and get on their calendar within the first month they were there, and I would introduce myself, and then I would invite them to our meetings, and I would try to facilitate a good working relationship right off the get-go. I also really now have been thinking a lot about this, and physicians right now have a lot more downtime than they've had in ever because their elective procedures have either been cut or they're so few and far between that they have long periods of not running around crazily. And if I were still in the quality realm, would be taking an opportunity to sort of reinvigorate and reintroduce all of the great things that the quality data provides for hospitals.
Mm-hmm.
I really think that right now, too, this is a great time to have those who are in the decision-making capacity listen to what the quality teams do and to how it can help impact the story that the hospital wants to tell overall about their patient care. And so those are some of the things that I did that I really think would work and what I would still be doing now if I were in my old position.
Right. I think those are some great tips that we should all be using in our day-to-day communication nowadays. And so based off of your experience managing the entire team of remote abstractors here at Q-Centrix, what recommendations do you have about managing communication within teams, not just physicians, in this virtual environment?
So I think that there is an automatic stigma that when we talk about the concept of communication and we go to a virtual environment, that it gets fragmented and broken. And really, if we focus on it, the opposite is true, that we communicate more cohesively because we're almost forced to, in a way, because we have to engage and interact with each other in a virtual way. I would always recommend having a fun management style when you're trying to work with a team that is remote. It doesn't always have to be about getting right down to business, but I think that you do need to be organized and you need to be very aware of everybody's time. I would also say, let's take the stigma out of it. I mean, we're all at home, we're working from home right now. Let's get on video together. It's cool if you see my poster in the background or my doorway because I'm working from home just like you are. And if someone's not able to get on video, that's fine. Just make sure that everybody's engaging with you and paying attention and not, having something else on in the corner while they're half listening with their one earbud in. Make sure that everybody can actually actively participate.
Absolutely. And despite this lack of in-person connection, how would you recommend that we build relationships in this new virtual environment?
So I think that the relationship piece is really important because it's really at the heart of what we do in healthcare is we work with people and we work with humans and we have to develop a trusting relationship as we provide care. I know, Christina, one of the things that I always did as a manager, especially working remotely, is, I would pay attention to people's birthdays and anniversaries and that kind of thing. But I would find out something that was unique about their person, and I would ask them about it. Like I had a person one time that was learning calligraphy. She was like 62 and had never actually learned how to handwrite. She only knew how to print. And she's taking this correspondence course. It was really cool. And so I would ask her about it, and I think finding the things that people like to talk about or that they're investing their time in and having you ask about it just shows that you care, because I do care about my employees. I want to know more about them than just when did you clock in and when did you clock out and what did you accomplish. Yeah, it's what makes people. And then the other thing that I did, which I had a lot of great feedback in, is that I would always ask my team, especially when I first started here at Q-Centrix and doing the job that I did for Inova, I would ask my team at the beginning of a meeting, and we took turns, sharing a little synopsis of what their ideal favorite vacation to either that they'd already done, or that they wanted to go on, what it would do, and where it would go. And so everybody kind of really got into that. Like some people brought a poster presentation. It was virtual. So one person held up pictures from their vacation that they took, and everybody had a lot of fun with it. So I just encourage you to do fun things besides just get down to the nitty gritty of the meeting.
Yeah, and that seems fun. It seems like it helps maintain the human element within your work. So that's great. Now I actually want to switch gears a little bit, and I'm curious about your perspective on staffing models throughout all of this. So you've partnered with organizations that have chosen to engage in a number of different staffing configurations. So can you tell us a little bit about any specific recommendations you have based off of these models?
I'm glad you've asked me that question because I've had a lot of time to think about this because there's things that I'm seeing in the marketplace. So one of the things I'm seeing, I'll call it like mandatory PTO. The other one that I'm seeing is a job share scenario where, Christina, maybe you work one week, you work Monday, Wednesday, Friday, I work Tuesday, Thursday, and then we flip the following week. The other one I've seen is where people are being asked to work, they're 40-hour employees, but they're being asked to work only 30 hours. And all of that has very real impacts on the budget for not only the hospital, but your personal budget of what you're taking home. And I'm sure that there are a lot of mixed feelings about being asked to do that because the work is still there. But one of the things that I would encourage everybody to do is to focus on good communication, which I think is the running theme of this conversation. But the good communication is something that will set each of you up for success and will save time in the long run. So Christina, in that model I just shared where we're job sharing and we're off days, you come in on a Monday and you met with Q-Centrix and we discussed a fallout with you on a couple cases and you started doing some research to get back to us, but you need me to finish it up on Tuesday. So I would just encourage everybody to go back to the good old nursing communication SBAR that we all know: situation, background, assessment, and recommendation, and use those four quick formats to just talk about, what's the background, what did you find, and what's your recommendation, and put it in an email format so that you can each pick up where the other left off. It's clear, it's concise, and it helps you organize your thoughts of what is the ask that you need your colleague to do for you, so that you're not getting calls on your day off because you're not being compensated for that day off right now.
Right. That sounds so helpful. And I really want to use that in my everyday life now. I feel like I will be so much more productive using that model.
True story. I've used it with my husband on many times. And I actually just thought about this. I recently used it with my 3-year-old. It did not have the same level of resignation that I have with my husband, but I tried it and it does work.
All right. Noted. So. All right. Well, as we begin in the pandemic situation to approach business as usual, what are our partners planning, or what have they already executed in terms of these staffing models?
So I think one of the things I don't think there's going to be business as usual. I think care has had a fundamental shift. We're in the shift. We don't know yet what it's going to look like. But I have seen some interesting things. So I think that in general, the quality teams are going to be one of the last folks that sort of report back in, because there's the different recommendation of waive openings by the CDC. And so first you'll bring back your ORs and your elective procedures, et cetera, et cetera. I do think that when quality teams are coming back into the building, that there are going to be asks, because I've seen this already with some, where some of the quality folks who've been outside of bedside care for a long time are asked to help in the recoup and recovery phase. So they may be asked to help where maybe take blood, do blood pressures, help in some more techie jobs by ClinTech or patient care technician, whatever you want to call it. And I just would encourage folks, because I do think that that will be met with mixed feelings. I encourage you to, I guess, take that as an opportunity to explain what the quality team does. You will find that there are more people in the hospital setting that don't understand what the quality team does and why it's important to know your numbers and what's the story you want to tell with your numbers. And ultimately, the reason that everyone went into healthcare is to benefit patients and to benefit patient outcomes. And so I think that if everybody approaches it with the attitude of, I'm being asked to do this outside of my realm, but I know that I can use it as another opportunity to talk about the work that I truly am, here to do at the hospital, it is going to have a wonderful impact ultimately on patient care.
Got it, I see. Well, we're getting close to the end here, and I want to get to this topic. So, as you know, Q-Centrix partners with more than 650 hospitals across the country. That said, how can folks be optimizing their partnerships, and how should we be supporting people during this time?
So I'm really glad that you asked me that question, because I've thought a little bit about just doing this conversation even today. And I think that it is going to be really important for our partners to realize that they can come to Q-Centrix and not only talk to us about the work that we're doing for them, that we have been able to provide a consistent quality work of abstraction throughout this crazy time, but that we also may have other skills or other expertise that we can assist as they begin to come back in the door and kind of start life in the new normal.
Mm-hmm.
I also think that here at Q-Centrix, we can recognize the fundamental shift that I said I think is happening right now and we're in the middle of. And I think that we can continue to provide support, provide consistency of quality, and help everybody remember why we're all in this realm, and that's to better patient outcomes and patient care. And I do think that we are uniquely situated at Q-Centrix to see what's happening nationally, because we have such great partnerships with our hospitals. And I've just really appreciated the transparency of what's been going on in each hospital's doors with what they're seeing, and then what they tell us, because we can better help support you if we know what you're going through.
Yes, absolutely. Transparency is key, and I like that little note of positivity there. So I'd like to end on a similar positive note on motivation. So I've noticed this as a concern for myself, for my colleagues, and just as a general observation for seemingly everyone that's going through this right now. So can you give us some insights on staying motivated in a remote environment?
Yes, it's not always easy. I'm not going to. I think that it can be a real challenge, especially when you're going on month 3 and you're like homeschooling the kids and your husband's working from home and or your roommate and you have a small place, et cetera, et cetera. But it is important to stay motivated. So the first thing I will say is you need to carve out time for yourself to start your day right. So if that means waking up 20 minutes early to go do a little bit of exercise, if you're an exercise person, or read the newspaper, have a cup of coffee, I would encourage you to do it for your own mental health. I would also make sure that you take breaks throughout the day, because we can get drained and exhausted being on video all day long and being on all these conference calls. And I do think that there are many people wearing many hats. Some of you are wearing hats where you're part of the crisis response team. Some of you are being asked to do quality work, and you're being asked to evaluate trends in your hospitals, and that's very hard. And so it's very important to take breaks, because you need them, and everybody understands that you need them. And then the last thing I'll say is that at the end of the day, and I've said this a lot, but I don't think there's ever been a more important time to know your numbers in healthcare, and there's never been a more important time to really hunker down with what work we do here in quality, and just dig deep and just focus, because every patient that we review is ultimately leading to a better outcome for patients overall in this country. And that is really important work, and we need to not lose sight of that work.
Absolutely. Well, I think those are some really great tactical insights and tips that you've given us today. Unfortunately, we are almost out of time. So do you have any closing remarks for our listeners?
I just want to thank everybody for their time. And I just want to say that it's really great to be a part of an organization that is doing this, because I think we hear a lot of negative in the news. And I think that there is a lot of positive that we're all trying to do and work towards. And I think it's great. And I just really appreciate my partners and my team's feedback to me, and just know that we're here for you if you need anything.
All right. Well, I appreciate your time and all your insights, and I'm looking forward to learning more from our other Q-Centrix experts as we close out this series. So thank you to you, and thank you to everyone that has joined us today. And please stay tuned for the next episode in the series. Thank you.
Thanks, Christina.